Welcome to the Healthusiasm podcast, a panel discussion on innovations in health and self-care. My name is Christophe Jauquet. I am a health business expert, author, and professional keynote speaker. And every month or so, I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this discussion, well, I have only one of your beloved experts in the panel, which is from France, but enjoy work life in Barcelona, Aline Noiset.
Bonjour.
That means that we are missing our digital health expert for startups, Nia Escobar-Kulle, medical expert in digital innovation, Dr. Keith Grimes, and human experience expert, Mo Zouina. In that case, we always invite special guests to our panel, some new blood, some other expertise. And this time we have, from the Netherlands, GP, author, and expert in positive health, Caroline van den Brekel-Dijkstra.
Hello.
From Spain, but living in Austria, also already been on the show, actually, Begoña San Jose. She's a psychologist and happiness expert.
Buenas.
And last but not least, from Ukraine, medical doctor trained also in foresight, we have health policy and systems expert Katerina Ostrovka. Did I do you any rights with these introductions? Because we quickly did it. Anything that I missed that you want to share? All good. Very good then. So on top of that, next to our three new guests, we also have somebody else with us. It's called the sixth man in basketball and it's the 12th man in football. And the reason for that is that because we are live in Helsinki at the Radical Health Festival, another live episode. Can I hear yourself, please? No, that's what I'm talking about. So today we have this nice panel here, different experiences, different expertise. And we will be talking about Healthusiasm, of course, but something very specific. Let me first introduce Healthusiasm for everyone again. And it's always difficult for me because I've done it already like for 8 years long, almost every week, multiple times. And I think I change it every time again. So I hope I do it rightfully so again here in the best possible way. But Healthusiasm, if you will, is the combination of the word health and enthusiasm. And what I truly believe is that people are more than ever occupied with their health. They're more than ever enthusiastic to do something about their health because they have more technologies, because they have different aspirations in life, because their basic and social needs are largely fulfilled. So people become more aspirational, but also because there's more and more support in the world to help you yourself with your health. I mean, there's non-healthcare companies that move into the space as well. So because of all of that, what we see is that people take more and more actions to impact in their health. They are more conscious about it. They are more demanding, maybe even. And what I sometimes believe, if I look at the healthcare industry, and we are here at Radical Health, which is primarily focused at the healthcare industry, what I sometimes believe, and I also said this morning during the opening keynote, is that within the healthcare system, we don't always have what I call Healthusiasm culture, meaning we don't have a culture in our healthcare ecosystem that thinks about this Healthusiasm that people have. What is important for them? What are their expectations? What are their aspirations? And by basically not paying attention to it or even ignoring it, we don't provide always the best solutions for our patients. That is, first of all, the statement that I want to make here before we go deeper into that. And Aline, I know what you think about, but you want to jump in and complete what you think about Healthusiasm and how it is important just in general. Do you also feel that in healthcare, maybe we lack a little bit of Healthusiasm?
Sure. No, you did a great introduction, as usual. But Healthusiasm is more and more important. I think that's what people want, people need, that aspiration, inspiration that will get you going. And people's expectations are also changing and they go back to their roots. And maybe we're good at that in Europe, but we work to live, like to really be happy. Mm-hmm. And that's what's happening. Those Healthusiasm, not going back to that, going back to the roots and those small things that can make a difference. And also linked to longevity, what we're discussing in a session before, having those small elements in our day-to-day life.
Yeah, Begoña, I know you're a big fan of the podcast. I know every time I see you, you ask me, can I be on the podcast? No, I'm just joking. But you should clearly show that you like to be on a podcast because you actually live and breathe healthusiasm as well. Do you think that the healthcare system needs a little bit more of healthusiasm?
I think it needs a lot more enthusiasm in general, because without enthusiasm, it's like keep going like robots, if I may. In the times of AI, I think is one of the autopilot. You just go, go, go. And enthusiasm is what makes a difference between just going to, ooh, let's rock it.
Yeah.
I do follow Healthusiasm podcast regularly because of the inspiration and aspiration and the hope that it brings together. So it's not, we're saying about these innovations are taking place. It's like where, how, and how can we transform from that into the reality wherever you are and whatever your position may be.
Yeah, and it's not just about the innovation and the technology, it's really about the human. And we come to that as well. But I want to, go to our newest member of the Healthusiasm family, if I may say, Caroline. After having heard now live here what Healthusiasm is all about, how do you look at it? And what's your thought on the healthcare system, whether or not it has enough health enthusiasm?
I think we need a lot of health enthusiasm because we talk about disease. I'm a general practitioner and we learn about diseases, and the whole system is about diseases. And I think if we start talking from out of health, we get a totally different world. We get a different world because everybody says, what is important to you? My health. But we don't act upon that. The whole medical system is about complaints about diseases, and positive health, the concept where we look broad towards health, because health is much more than the absence of disease. That is exactly what health enthusiasm is. So I guess we hope to speak each other more frequent, because I think we're on the same ambition.
Yeah, I think so too. And that's exactly why we wanted you to have, Aline and I, we were looking at the whole list of people that were on at Radical Health, and we looked at your profile. I was like, this is Healthusiasm, in its purest form always. So I'm happy to continue the discussion on this health positivity you're talking about. But let me first go to Katerina. What's your thought on healthusiasm from your expertise and your point of view? Looking at the healthcare system again, is it lacking? Do we need more healthusiasm or not?
Well, I consider that we still have this path dependence. In the sense, we're living the used futures. We're living that way how our predecessors constructed the service systems. And we sometimes lack imagination, although we're kind of enthusiastic and anticipating there are new technologies coming, but they're coming to accelerate the decision-making process, just kind of to speed up, but not kind of transform it systemically. And quite often we also overlook the way how this enthusiasm being placed, what it just commits to. In the sense, there is a huge disbalance in my understanding between supply and demand side in services. Sometimes the pharma, the other kind of industry, which are really necessary to us, but they also act as very contributing actors, the way how they displays the initiative within the system. And sometimes we might be doing different things if we're asking different types of questions. So my sense is of that kind.
If I may say, it's exactly what we need. We need new narratives in health. We think that if we have more money or more people, we can. There's a lot of people are talking about health crisis to come, but I don't think those are the solutions. I think the solutions are really to look different, to have a mindset shift. And actually, it was interesting to hear that from our Finnish minister yesterday. She said, we need a mindset shift. And I think the solution is in us, in the professionals, in ourselves, in everybody. Because if you have something in your body, your doctor's going to tell you what you should do. I mean, who am I to decide for someone to fix a problem? So what we do with positive health is we have people get insight in their own health, and then we start talking about what is important to you, not what do you want to get rid of, but where do you want to go? And that's really the place to go. Then you get to the intrinsic motivation of people. And that's interesting. I'm curious what you think about it, how that will work if we do this more.
So we mentioned positive health twice or 3 times already. Maybe it's good to, is it an organization? Is it a training? Is it, what do we understand about, for the people that don't know it, what is positive health exactly?
It has been founded by Machteld Huber. She is a GP herself, and she got sick herself. And when she was a patient, she realized that everybody was talking about disease and not about what she could do to promote her diseases. She went into research about what is health. And then there was an international meeting where they said we should change the definition of health. Maybe we should change it to health is the ability to adapt and self-manage to the challenges we face into life. These challenges can be physical.
Wait. Say that again, slower. So
ability to adapt.
Yeah.
To the challenges of life.
Okay.
And we can have physical challenges. We can have social challenges. We can have mental challenges.
Okay.
And then also to self-manage too. So to take care of the challenges you deal with. And that's actually, it's dynamic. It's not static. And if you create like the resilience to deal with the challenges of life, that's where health starts. And then and that's how she did the research. Then from out of her research team, she asked, like, do we agree upon that this is what we talk about when we talk about health? They asked, if I would ask you all, what is health? What does health mean to you? Then what would be your answer?
What health means to me. For me, it would be being in good health, like being able to live life normally, enjoying life, having good energy.
A good energy. And Christophe, what would be it for you?
Well, if I would answer from a personal point of view, I would say it's the basis of living a good life. So without it becomes a bit more difficult, or even way more difficult in some cases. If I would look at the word health care, I think I then think about it as science. So it's the word healthcare has care and health in there.
Yeah.
And I think health to me then becomes certainly science, which is something very strict and procedural and system driven and so forth. So I have these two words.
Yeah. Vigo, what does health mean to you?
I will come back with Christophe. So if I look at healthcare, I will put care before health.
Yeah,
So
I would
will
love
say
to, for sure.
care
Yeah.
health, yeah? We are in the care health field. And if we look at it that way, then caring is what allows health to happen in a way.
Mm-hmm.
So
Caring,
caring is what allows that to happen, but it's certainly far from absence of disease.
Mm-hmm.
I think a lot of people with disease are healthy.
Yeah, that's true. Yeah. So
And,
that's
it's just a label. I mean, if you don't have a diagnosis, you're not healthy. Huh? Excuse me. I mean, who doesn't have a diagnosis anyway? Even if that is, I don't know, attention deficit, or hypertension, or it doesn't matter. Does that make the difference between being healthy and not being healthy? So I think it's quite arbitrary definition. So for me, health is just, maybe it's closer to happiness. Maybe that gives me the title.
and belonging, because I know that's an important word for you. So maybe just to finish up, what is positive health? What is health for you?
Well, I consider this a possibility to unlock many, many domains in my life to the fullest somehow. So, and I probably also add that it's really important to recognize that it's a trade-off that politicians very often play with to kind of decide what is the right determination of the health. If we qualify this person healthy or unhealthy, should we invest money there, here and there? And you're actually bringing a very important question to the table, because it's at the core, how the money would be redistributed in the system afterwards, right? So it's just not only our personal decision, but just it goes upstream, and how it would be decided, nobody really knows. Should we cure these rare diseases? Should we invest into the chronic diseases? Should we treat adults, or still care more about vaccination of newborn babies? So in this sense, it's just something that kind of very, very cross our mind very often, but it's on the agenda of everyone.
It is. Yeah. So just to wrap up, what is positive health? This question, what does health mean to you, have been asked to a lot of people. And we came up with 500 indicators of different, what people answered of what was being healthy. And then they grouped this to 6 categories. And these are the 6 categories used in the reflection tool of positive health, 6 dimensions. It's the bodily functions.
Bring them on.
Of course, are you physically healthy? The mental functions. How do you feel mentally? It's about meaningfulness. That's the 3rd dimension. quality of life, and it has to do with safety and housing, but also about balance, participation, so belonging, and how do you participate, how do you connect to people, and daily functioning. And these 6 categories are plotted in a diagram, and this is a very easy reflection tool to use in daily conversations. And that is what we use, the reflection tool of positive health, which helps professionals to have conversations with their patients. So it's a broad vision, and it's a tool, and this seems to be a driver for change.
And actually, we're very happy to have Caroline tomorrow with us at the Happiness Workshop here in Radical Health Festival, where we will be encouraging human connection with the participants by bringing the topics that go beyond their titles
So with
or their industry, the positive health questions.
so you do that with the people on stage or with the people in the audience?
The people in the audience.
Wow.
So they, instead of, a happiness workshop is interactive. So it's never a lecture. It's very far away from a lecture. So we facilitate people living through some of the elements of happiness. This year is belonging, because as part of the healthcare ecosystem, we may know we are there, but we forget the human side of things. We forget to connect and to find the reality on the connections. And Caroline will be facilitating the human connection through positive health conversations.
So you train physicians, if I understand correctly, to use these 6 pillars and talk about with their patients to make sure that they have a better understanding of in what state they are, let's say health, happiness, healthusiasm, whatever, it kind of come close actually. So this is how it is, right?
Yeah. So, and it's important to have no norm. So it's like not good or bad. So it's not,
No, it's just-
are you healthy or unhealthy? It's just, how is it at this moment? Like a thermometer. How do you feel today? There's people who use this every week. You don't have to be sick to use it. So even citizens use it. We use it in schools. We use it at work. Like, how can you work in a healthy way? It's just to check in. How satisfied am I on the 6 different dimensions? And then the question is there something small you want to do? And what do you need to actually go do it? So it's also to get into action. And we see surprisingly interesting, more deepening conversation in a very short time. It's really interesting.
So I really love that topic. And for me, it really goes to holistic and functional medicine. I think that's where there's still a gap today in healthcare, because you go and see your doctor and it's all silos, no? So he will look at, well, if you have some like stomach issue, he'll look at the stomach, and you have some like head issue, you go to the dermatologist, but nothing is linked, right? But at the end, looking at the different dimensions that you're mentioning, today we're treating symptoms, but not the causes. And maybe the causes are coming from one of the points that you are mentioning, but the stomach doctor is not looking at that other point. So the problem keeps going. It's not actually being fixed. So I think that's a great evolution, and that's where medicine should be moving to. And Mo would have a lot to say about that if he was here.
Yeah, I think Mo would definitely have said that.
I can say that earlier this day, Caroline so wonderfully complimented our session on women's health. And at some point, we ended up thinking that we need to redesign the systems with many, many kind of elements in mind. And I think that we would end up incorporating this idea in many services, right? So in the sense, it would be a designing of the life somehow. And also, like a person who contributed to health policies, I'm still thinking that there is a certain missing metrics for analyzing the policies. So the concept health in all policies, it should be really the everyday life exercise. And there needs to be a basis. So why not to kind of ground this in this particular plot, in this particular diagram, to see how it shifts the well-being in a wide sense, right? So it needs to be started somewhere in a composition that has been acknowledged. So why not to use this one?
But the only thing I think is, you talk about a basis, so you mean a benchmark then?
I think rather we need to have a certain mental map, mind map somehow. So kind of we look at what kind of domains it fits into, because sometimes we see it in silos. So let's say there is a Ministry of Health and Social Affairs. So they look only into their policies, or we have different other ministers, and everybody kind of try to help the citizens to be promoted through the constituency. But in this sense, we don't have something that would be assembled in a one kind of place. We would see through a one paradigm, let's say, kind of through one lens. And at the end of the day, we want people to live their life a full one, which has different parts to this.
Yeah, I think to piggyback on that, I think what I've been saying for, I think since 2017, 2018 is that basically, in my opinion, health is not a vertical, it's a transversal. It touches upon everything. And so the example that you gave with, there's a department of healthcare, but it should also be in social and should also be. And I think that exactly that idea of having maybe these exact tools going transversally over different businesses, but also different departments, different ministries, and so forth. So I think I really like that idea.
That's what we already see now with 10 years experience in the Netherlands. It's not only on the one-on-one level we have conversations. We use it in an organizational level, so in teams, to make sure that you know what is good to be vital at work and know what your colleagues want, but specifically in communities. So we create resilient communities because this is a very shared language. And interesting, where I live in Utrecht, we have schools working with positive health, our community houses, we have citizens having positive health conversations with other citizens. So the social work, but also the medical work. And it's really a bridge, like social prescribing. It's like the doctor, sometimes they come in with the doctor and they have all kind of complaints, and it turn out they want to do something on a participation or a meaningfulness. And then they say, well, you better go to either the lifestyle coach or the people, the center where they have all those great activities. And then I don't see them back into my GP practice. Right. And the interesting part is the results are, one of my colleagues did a lot of research. The patients feel more heard and seen because they think, hey, this doctor is really listening. And the doctors, they think, wow, this is why I became a doctor. This works, and you don't have to work so hard. It's lighter. Yeah. And then it seems that we have 25% less costs, referrals to the more expensive medical doctors, because you said, I don't have to refer to with stomach pain again if they've been there 2 times and I know they're in a divorce and there's a lot of old problems, and then we'll talk about the other things which give them what the cause is for all their medical complaints. And people start to see themselves like, oh yeah, I understand why I'm so tired now because so many things are going on. So they start even saying, I don't need a medical solution, and that's really interesting.
And you know what I like about, so my first book, the first Healthusiasm book, said, I kind of explained what Healthusiasm is. And it had the subtitle, Making Customers Healthy and Happy. That was the subtitle. Why did I use customers? Because a patient is a customer. You have consumers, you have employees. They're all kind of, in a way, customers, visitors, drivers, whatever, users of technology and so forth. So I wanted to make sure that it touches upon everything. But so many companies came to me saying, like, you're right. This is exactly what is important. But what is healthy and happy? We struggle to really understand what it means. And for the second book, I was challenged with that question. And funnily enough, I did 4 years of research and I came up with 24 different, what I call life aspirations. And they're categorized in 4 buckets, which is prevention, acceptance, which is a very important one, enjoyment, and then improvement. So, and then you have underneath 6. But interesting enough, meaningful is one of the aspirations. Belonging is one of the aspirations. And there's 22 more, of course. But it's interesting to see, and I'm happy to see that it kind of correlates. And you see it pretty much everywhere. So that's interesting. I think it's very good that Positive Health is focusing on these providers, healthcare providers, that it actually works, that it helps to have these conversations with your patients and the people that are in front of you. Now, that's one part of the angle. If we think about Healthusiasm culture and we look at startups, for example, do you see that startups have enough of these, Healthusiasm lens in their everyday work? Do they incorporate it in the way that they approach their business? Or are they already in the typical healthcare sphere that kind of is focused on technology, processes, move forward? What do you see?
So I would look at startups from 2 different angles.
Okay.
So first, like the creation of the startups. And for me, that's like the biodesign concept. So that's coming from Stanford University. And it's really unmet need solution. So you identify a need, a problem, and you build a solution for that need. And what I've seen those years working in the ecosystem, there's a difference between biodesign startups, like startups really created to answer a need, or startups that come with a technology and say, oh, I have that cool technology. Let's push it to a healthcare sector because healthcare sector is great. There's lots of money there. Doesn't work like that.
I'm just going to, when you said, oh, great technology, we need to have this in, I immediately had to think of all the startups that I know that had physicians in them or as founder. So I often see that same, it's not just somebody who wants to go into healthcare. Sometimes they're already in healthcare and they see the technology and think, oh, we should do this because this technology is amazing. So I just wanted to say that I had also this, me personally, I had this idea of, oh, these are all the physician startups, but
yeah, no, not always.
No, sure.
What I found is that the startups with patients involved in them, they are the strongest because they know the problem inside out. Like they have lived that situation, so they really develop solutions that make sense. Well, then there's the business involved. It's not always successful, but for me, they're the strongest. They go the furthest. And those who have technologies coming from other sectors and trying to push it to healthcare, it's not always so successful.
No.
So that's the first part about creation of the startup. And then looking at the startup from like a startup is trying to attract people. I think that's maybe where you were going, like the culture inside the company. So what I've seen evolving those past years is that the younger generation, they have different expectations, what they look at the workplace, what they want in a company. And I've spoken about that with friends who have startup themselves, and they have to adapt a bit when they want to attract talent. Mm-hmm. So the younger generation are more interested in like quality of life. So they don't want to be working till like 10 at night. They want to have some games, like a fun office, like maybe video games or
ping pong.
Exactly this. And yeah, they want to be their freedom. They stay in a company maybe for 3 years. So that's their healthusiasm. And you have to take that into account. You have to understand the people that are going to be joining you. What are they interested in? What does healthusiasm means to them? Mm-hmm. And to integrate that in your culture and your startup.
And then we come to you, Begonia.
What I see as well is a lot of people in the healthcare industry in general, but in startups in particular, that are forgetting themselves in the journey. So I see a lot of people burning themselves out, which doesn't do any good to any one of us. So if we get the people with the great ideas and great projects and potentially able to raise 1, 2, 3 finance rounds of investments around them, but they neglect themselves along the way, or they disconnect with the reason why they started, or they misalign with the values that drove them to solve that problem in the first place, then it's not sustainable. So it doesn't build the resilience that we need from the system. And it's not so much of the people itself, it's a systemic failure. So it's a system that leads to that. So I've actually worked in a startup, and I work with and for startups myself as well. And to be driving what we do today, depending on the next finance round, is not necessarily the way forward to bring the innovation.
It's a lot of pressure, time pressure.
It's a lot of pressure that is not, that is not justified or is not properly absorbed by the system, let's say.
I once had, just to piggyback on that, there was a huge debate on LinkedIn where a successful startup founder, exited already, I think, once or twice, was talking about hustle culture. And he was specifically referring to France, Aline, where he said that startups in France, they have no hustle culture. They stop at 5 o'clock, and this is completely unacceptable. It's like, and he made a poor reference. I actually, talked about it with him. He referred to top sporters. Top sporters go all the way in, and they don't give up, and they go all. And I was like, no, that's not true. They do a lot of recovery. Actually, most of their work is actually recovery, so it's a bad reference. But he was actually blaming certain types of startups for not having that hustle culture, while he himself already had a burnout. So it's pretty remarkable what you say. I mean.
And they're actually saying how many burnouts they've gone through. So this is my third burnout, and I have already, and it's like really, and I'm part of Tech to Impact back home in Vienna, and they've been raising money to study and to prevent burnout in impact founders. Because without this innovation and without this fire that brings this innovation forward in the impactful sectors in the industry, and of course health is one of the top ones in the list, then what? Then we keep on having the same thing, and that's not something we all want. And if we ask what is the healthcare system we want in the future, let that be tomorrow. Yeah, we don't want it to remain the way it is right now.
Yeah.
I think we can ask the audience if they would like to go to a doctor and wait for an appointment, or wait so many hours, or have 5 minutes of a visit, or have a prescription as before they walk out the door, they already have the prescription, or would they rather have quality time with the doctors where they understand what is going on and contextualize and personalize and understand a bit of the root causes, as Aline was mentioning earlier, yeah?
Maybe I can share an interesting project I did. It is about new narratives in health. And we did this in 4 countries, the UK, France, Belgium, and the Netherlands. 3 meetings where we were dreaming about the future in 2040. And the interesting part was that we had stakeholder meetings where all actors were in the room. So we had patients, young, old. We had people from pharma, from insurance company, academics, medical, social. And we were dreaming together about the future of 2040. What do you think?
What, you mean, like the sentiment?
Well, the interest, yeah. What do you think what came out? Because it was exactly the same. It didn't matter we were in the UK, France, Belgium, or the Netherlands. And it didn't matter what the work was the people did. Because if you work in insurance or you're an academic, as human beings, we dreamed about how does it look like? It was about trust. It was about connection. It was about
Aspirations.
seeing the humans as a whole. It was about fun. And it was about making things more simple. And this was exactly the same in all 4 countries.
So how many money did you pay to do that study?
Not much. It was like Ashoka, the social entrepreneur. So it was so interesting.
I understand.
And you know what happens? Everybody is complaining about the system. Because everybody thinks if the system changed, something changed. But we got to change. We're the solution. It doesn't matter where you are.
I would probably add to the idea of changing the system. So in the sense how we structure the payment in the system, it might influence and distort the market. That some saturation points in certain innovation, it just supersedes the others. And let's be honest, health tech is underfinanced. And there is a few kind of initiatives that kind of manage to raise enough funding. And it also the case that I think that, we need to acknowledge that US can afford being not as efficient as European markets because there are not as much VC capital or capital itself here to be inefficient. So this is how should be reconsidered when the need and the finance is being constructed within the systems. So we place the importance on different initiatives that need to develop new solutions to the problems we're trying to solve, but not to kind of to struggle for getting the funding, because where the money, there will be the idea brought about, right? I'm sorry for being so pragmatic after such high and aspirational ideas. I feel like the person who spoiled the day.
No.
Well, it's about dreaming or being realistic, of course. But I guess if you really want to make a change and it's good, the money will follow. So as an innovator, you're always ahead of things to change. If you wait for systems to change, nothing's going to happen. We don't have time for that. It's urgent.
Yeah, definitely too. You wanted to jump in?
Yeah, I think there are 2 things. The one is the system. I think we need to get accountability of we are the system. Yeah. So we're not waiting for anyone to come out there and say this is changing. It has to start from ourselves and from inside. And having worked more than 20 years in insurance, yes, I have worked more than 20 years in insurance. I can tell a bit about the money And maybe it's a reallocation of resources question, point number one, maybe. And then there are many things that improve our health that cost nothing at all. And I'm in a panel for social prescribing tomorrow. But actually the result of having these devices on our pocket is we need to actually get prescribed being out there, outdoors in the forest, or having some time to do something creative, or engaging with our hobbies or our families or something like that. So yes, it does come with money. I don't think, I mean, it was mentioned today also at the beginning of the conference that we just need to reallocate the resources and continue spending money. Let me say spending instead of investing. Money in the wrong things will not give us different results. And looking at the whole thing from scratch and say, okay, if I have €5, which is what I have, it will not stretch, it will not be 10, it will not be with case.
And that's what makes the Middle East super interesting. Every time I'm there, they start basically from scratch, right? And so the way that they move forward is super interesting.
It's redefining it. I mean, I cannot understand as of today. And I was at the gynecological office last week doing my annual checkup, which I recommend everybody do. Whoever is in the medical practice waits for X amount of time to see one doctor, and half of what the doctor has to say can be shared in the waiting room. We are all going there, and she has to repeat and explain to everybody that the pap results will not be shared with you unless they are pathological. And they have to repeat themselves what happens when you do this and when you do that. And half of it is like completely 80% can be common. And it doesn't have to be on a one-to-one. It can be on a one-to-many basis. But we haven't even thought of it. And so why don't we use that space and then call every patient that has an appointment between 10 and 11, share some of the things, create the community, share the problems that we're having, what you're doing, what I'm doing, what you're not doing, and so on. And then, yeah, you can have 5 minutes of personalized care, but having done 80% of the common grounds it's just a reinvention of the system. So it's a way of looking at things from scratch and say, okay, how can I fix it? My last piece on health management, actually, you may have seen it, is on kintsugi leadership. Mm-hmm. So why don't we fix the healthcare system that is broken with the kintsugi ceramics methodology, which makes it more valuable after it was fixed than before.
Yeah.
So how do we fix the system so that it's better than it was before it broke?
Is that the ceramics that are fixed with the gold?
Exactly.
Yeah.
That parallel thinking applied to how would you fix the broken healthcare system in a way that you put gold into that and make it even more valuable and more beautiful than it was
How
before.
Beautiful is that? How beautiful is that? So, Aline, go ahead.
Yeah, maybe something that kept to my big. I really like your idea of like grouping people in the waiting room. I think the power of the community, power of the patient, because at the end, us patient, we know ourselves better than anybody else. And maybe the doctor, they can't know everything, right? And you have just like that short time to see patient. But maybe in the waiting room, what will happen is that patient will start talking between each other, say, I have that. Oh, me too. Then what happened to you? So creating that synergies between the patient can also help like reinvent or transform the healthcare system and improve our health as a consequence.
And it can be moderated.
We have great of these examples already, and we don't even want to have the people in the waiting room. There's like sessions of people.
What a word also. I mean, waiting room. Can we get lost of the word waiting room?
Yeah.
What industry works with waiting rooms, for Christ's sake?
I agree. Yeah, it should be interesting. How could you call that? Like a health enthusiasm room. But anyway, there's like, for instance, we have an example. It's called Buddy House. And this is for females who had breast cancer, and they connect and match patients with breast cancer with each other. And this is much more worth than having a doctor talking to a patient with breast cancer. Because if you experienced this before, you don't even have to say anything. You understand each other. And this, we have a lot of expert groups where people are there for each other in all kinds of
amazing.
Yeah, in all kinds of diseases or practical things they have.
So one thing that is happening is that I know about such examples in the States, and I don't know about such examples in Europe. We don't share enough innovations in Europe. If you go online and you look for innovations in health, the only thing you find is China and US. Well, there's so much happening here.
I had actually had that question at lunch, and a local Finn asked me, what do you think we're doing not so right? And I said, look, if I look at, as you're saying, we can hear Singapore and we can hear the US and whatever. In Europe, we can hear Estonia, for example.
Yeah, for sure.
As the
Definitely.
digital health leading country, so to speak. But if it wasn't because of Radical Health Festival, I wouldn't know anything at all about what Finland is doing in terms of improving health. And they are a number of things and a number of best practices that we could do much better if we know about them. And I actually provocatively suggested that next year we have a session on failure. So when we are vulnerable and we are able to share what we failed upon, then we're likely to not repeat the same mistakes simply because we don't have time to make all the mistakes ourselves.
The startups have that mentality, fuck up Fridays, they call it. And they talk about all the fuck ups that they've done. Katrina.
Yeah, I really like that we started talking very openly about the failures, about mistake, about the kind of burden in the system. And I think that, let's say, lean management, it was kind of compromised during COVID. It was blamed for inconsistent delivery of medical substances, kind of for this restocking problem. But in the sense, if we start analyzing our services from the perspective, if it's a waste or it's a value, it's just kind of moving from A to Z, understanding that's kind of like alluding to this waiting room, is waiting is necessary. And there is kind of, I mean, those practices that already exist. They are kind of evidence-based. We don't use them. Why?
Yeah.
So it's just kind of about questioning ourselves why, and the way how these different types of mistakes might be presented and analyzed. It might be a really interesting conversation and even a conference. I would so be happy to go there to hear, to learn more, because success is something is to listen to get inspired, but everyday life is learning from the mistakes itself, right?
I think one of the big challenges for conference organizers would be they always try to limit each session to 1 hour. But if you start talking about failure, you should be probably doing, maybe it's a whole stage about failure. That might be a good thing. I want to still stay with the system, the health systems that we see, because we touched upon it a little bit. Maybe two questions. You can decide which one you answer. One is, do the health systems already have enough healthusiasm? I think the answer is quite double, probably. But do you see any good examples? Because I think we're on a good roll. We see some positive things. We see some things changing. Within the health systems, Katrina, do you see any good examples that might have a bit more of healthusiasm than others? Or how do you look at it? Things. I mean, we were talking about Estonia. I saw you nodding. Are there things there that you say, oh, this is pretty good indeed?
Whatever surprising this might sound, but I think COVID, there was the time when the medical professionals were finally recognized, but how they were treated afterwards, many of them were disappointed and just even went into the complete burnout. So in the sense, we need to acknowledge more and understand how we can redesign the system. And I think the Nordics are leading in a sense, because the visionary of women's health presented for the Nordics country, it has a potential for spillover. In the sense, this might be an idea how we can bring about the women's health as the discussion point, as an entry point for politicians, but also given that Nordic countries are pioneers in the sense of gender equality, they will have a lead through Baltic countries, and who knows, it might be kind of a cascade reaction across Europe. So I would say probably both, and I think you will have more to add to this. Yeah.
I have a question with regards to the Corona times and the heroes and the recognition of the job that the physicians or healthcare providers of the first line were doing, because we raised them to the category of superheroes, disabling them from feeling vulnerable, tired, frustrated, because I don't know any superhero that actually says, I'm exhausted, I cannot take it anymore. It's a Superman, you just go and keep going, no? So I think that was one of the things that, that would, maybe not so clearly go with, but of course the recognition of healthcare professionals as well as teachers, for example, is essential so that they also feel their value in the whole value chain. Because I think that we're talking about the healthcare system, and the word system means constellation system. We interact with one another. We affect one another. What I do affects you, and what you do affects me. And so the story goes. So how can we together be on one mission and not everybody on their single individual mission of arranging? We are all into improving healthcare.
Well, I think I do agree when you say that maybe the hero story that was taught to physicians and healthcare professionals was maybe not the best one. You don't do that with your child as well. You don't always say that he's wonderful and amazing, and you sometimes have to, be reasonable. What I do like, and where I do think that they were more than rightfully so recognized, is in taking initiative, in trying to innovate things, and trying to make things move forward. And I think there, after COVID, we dropped that ball again, whether it is in hospitals, whether it is individual practitioners. Caroline, you might have some examples and feelings there as well as a GP. I think there is where we lost their recognition. It's not too much about the hero story. It's about the responsibility, the accountability, the freedom is maybe not the right word here, but trusting, we talked about trust before, that they can do the right thing, that they have that healthusiasm to make things happening.
And the system supports them, because you still need the nets to be able to do the jump.
I wonder if we needed so much recognition, but it's just our work, This is my work, to work in healthcare, and that has a responsibility. And what I saw, what was great, is that we had a shared vision. So we were able to collaborate. And as soon COVID was gone, everybody went back into the silo and was thinking about their own things. And it also interesting, we were able to move very quickly to get vaccinations in a very quickly time. We were able to get a lot of online working. We were able to deliver care in a different way. And COVID was gone. And a lot of people, of course, a few things stayed. But a lot of people said, I still want to see my patient. I still want to do it. And they went back to the old system. So I'm like, what do we keep? What is helpful? And why do we have the feeling to go back to what we're
That's resistant to change?
But I think patients were also asking for that. I remember going to the hospital in Barcelona, like outpatient, and the hospital was full. And the doctor was telling me, no, but patients want that face-to-face. They want the in-person visits. So maybe it's not just our healthcare professionals. Because in that hospital, video consultation is big, but still.
But that also is per person different, because I have a lot of young people who don't want to come if they just want to have digital services, and I have elderly people who say, "Can you do a home visit?" And I have people who want to prepare their visit with positive health. So we have all different. That's not one size fits all, but it seems that we organize it right away back to the one size fits all, and I think that will be interesting to make this more flexible.
If I can go back to your previous question of example in a system.
Oh, yeah, that's a good one, yeah.
So it's not on the country level, but just more like a concrete example in a hospital. And it's called the Silent Hospital. So in the UK.
Yeah, I read about it. It's amazing.
Yeah. So they're actually using technology to reduce noises. So they really take into account the patients, and they want to improve outcomes for the patient. So everything is more silent. So when you need to contact the nurse, everything is done through special technology, but it's silent. So there's no big alarms in the hospital. So patients are sleeping better. Healthcare professionals, they have less that alarm burden on them. So I think it's a great example of how technology is having a positive impact and really taking into account the patient and outcomes for them.
Yeah, it gets a vibration on the phone. So it doesn't sound like beep, 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 beep. And that's also important for the well-being of the healthcare providers as well as for the patients. It's one of these great examples that, ideas worth sharing, we should have a health dedicated one so that we can be faster at sharing those ideas and implementing it. There's another one that marks the chemotherapy spots for children using simple pens that have a needle inside, but they have a superhero needle and then the mark that they make on the kid to mark where the chemotherapy points should go is actually done with a superhero pen.
Yeah, and you have these, I think, MRIs as well that are
Yes,
looking
exactly.
like
Yeah, well, there's the power of
boats.
visualization.
Yeah.
And the video games.
Yeah,
But
with
I mean,
virtual reality.
The cells.
What is very interesting to see is that if I look at hospitals, healthcare providers in general, and we're talking about healthusiasm and a great experience, like the most, I'll just say it differently. If I speak to hospitals, for example, I go online and I look for examples of hospitals and initiatives in hospitals that showcase a lot of healthusiasm, I always end up in children's hospitals. And that is something so, I don't understand why it is only possible in children's hospitals. It's not like they have more money. It's just, why is it that they can do the efforts? Because it's children, and as soon as there's adults, we kind of not.
We get serious.
Yeah, why should we do it?
We get serious, yeah.
I think it's a very professional driven construction to have big, sexy hospitals, right? So it's something that we can reconsider. It's about health, not about healthcare again. So in the sense, it's constructed for us, for our convenience, right? If we redesign, we need to think what would be the decision, what would be the solution to the problem. And it's quite often out of the vision of the medical professionals. And I think that also needs to be reconsidered for adult population, right? When we will be redesigning with keeping in mind that the demographics is of this kind. We're expecting there will be more women. Europe is aging in anything of that kind. So how can we also bring it to as close as to the customer? I'm avoiding the word patient, the P word, let's say. So how can we bring it closer and to some degree disload professionals as well? So
Lovely.
We are facilitating some of that in some of the serious hospitals, I would say. One is by getting them closer to nature, so arranging outings for the staff in the woods or in the forest or in the park of the hospital, or even recreating a little forest at the hospital or at the healthcare facility. For the patients, I don't know, for the consumers of healthcare, for the providers themselves, for whoever may need a piece of space, of a bubble in which they can also feel differently. All these aseptic guidelines is also part of the seriousness of the grown-up hospitals as compared to the children one, no?
Yeah.
We talked about it in the opening session last night at Radical Health Festival, where Jordi was presenting P8, so a prevention clinic, and he says that they are going to be doing their sessions in the nature, as you said, just putting two sofas outside in the nature. I think that's great.
Yeah, we needed liability insurance, just for your information. So insurance is one of the ones that you need to be covered for whatever may happen outside the hospital wards when you take patients out. But that's a minimum regulation tick on the box in this case. But it's interesting that we would only cover things that happen within the walls when healthcare happens everywhere.
Yeah.
Health happens everywhere. And therefore, caring for health should also.
I was thinking about, imagine if right now in Helsinki, we would be sitting outside in the woods in a chair with 20 centimeters of snow. And maybe as we are wrapping up this podcast, we have one of the organizers that is entering just the room as we speak. Pascal, please join. He's almost refusing to join, but there's still one microphone on the table. Pascal, we were just wrapping up this podcast about healthusiasm. We talked about the culture, everything that's within the entire ecosystem needs to change, how even from the policy standpoint, startup standpoint, company standpoint, provider standpoint needs to have more healthusiasm. And we believe that what you've done here with the Radical Health Festival is definitely adding to that. I think you bring this healthusiasm, you make sure that You talk about its radical actions,
Radical inaction.
radical inactions. And I think this is exactly what we need. So we'd like to thank you for that. But we also would like to give you the last word to maybe say what you wanted to achieve with the festival, how you feel after now 1 day and a half of festival, and what you're looking forward to.
Well, first of all, I think we call it a festival because it's a collaboration of content contributors. We don't pretend to know everything about everything in healthcare. So when we want to approach a topic, we ask the best people who are best organizations that can answer. It's radical because we are not afraid of, asking the tough questions. I think when we talk about prevention and precision health, we always hear good intentions, but we never talk about money. The session that is following this one is actually about how do we finance prevention. We know that in Europe, we still spend, I think, between 3 and 5% on prevention, and the rest goes to acute care. So at some point, we need to put the money where we say our intentions are. We're also radical because right now in Europe, we're in a difficult position, and we've had a few sessions today about considering healthcare as a critical infrastructure. Unfortunately, in the last few months, we've seen hospitals being targeted. I mean, there's nothing more sad than that. And I think it's a tough discussion that we need to have, but we need to have it because it's a pressing issue. And I'm really glad that you are hosting this podcast with us. It's very fun.
Thank you, Pascal, for these last words. And I'd like to thank all the members and the panelists of today for their Healthusiasm, because it is more and more a Healthusiasm world indeed. But time to wrap up the Healthusiasm podcast. Thank you for listening. If you like the show, hit the subscribe button on your favorite podcast platform. You can also visit healthusiasm.com to subscribe to the newsletter and learn more about our panelists. For now, I'd like to thank our panelists for their Healthusiasm. Thank you, Aline Noizet. Thank you, Pascal Lardier, for joining us as well. Thank you, Begonia San Jose. Thank you, Caroline van den Brekel-Dijkstra. And thank you, Katerina Ostrovska. This is the Healthusiasm panel. My name is Christophe Jauquet, and we'd love to see you again next month for some more Healthusiasm. Ciao.